swimming in their sports medicine committee and traveled all over the world with them, including being the head trainer for the 1996 Olympics in Atlanta and a member of their high performance team. Besides dealing with a lot of swimmers, myself, I train 5 days in the pool and compete in masters. So I'm pretty passionate about the sport. So what kind of issues do we frequently see in swimmers? Foremost is shoulder problems. Impingement is where the muscles on top of the shoulder get pinched between the upper arm bone and the roof of the shoulder. Instability is sort of a misnomer and often diagnosed. Swimmers as a whole tend to be very loose jointed or lax. And a lot of times it's not that they're unstable, they're just lax and they don't have the muscle control to do that. So it's important to get a physician that understands seeing swimmers and knows that's how the individual is.
Hey, Skippy.
Yes.
Will you share your screen?
Okay.
Sorry.
Is it up now?
Yes. If you'll just open up your PowerPoint.
Okay.
Good to go. Thank you.
So we have tendonitis or tendinopathy. We have scapular dysfunction. That's how the shoulder blade operates. And this is the most common things we see in swimmers. And if the shoulder blade muscles aren't strong and controlling where the shoulder blade goes, which is kind of your steering wheel of the shoulder, you're going to run into some problems. We get knee problems, IT band syndrome. And if you look at the picture on the far right, it's the band of tissue that goes down the side of your leg and attaches into the outside edge of the kneecap and below. And when that gets tight, it can either alter the tracking mechanics of the kneecap, or you can get some friction problems on the outside of the knee or up in the hip. And then patellofemoral pain syndrome is a tracking issue of how the kneecap works with the femur or upper leg bone. Low back pain, we see frequently mechanical low back pain, and that's a combination of how the individual's mechanics are. It's caused by muscle weakness, poor posture, tight muscles, poor core stability, and is easily corrected, well, not so easily, but corrected very well with physical therapy. SI joint dysfunction, that's where the hip bones come into the sacrum. It's a joint that is a little bit different than most joints in the body. Issues with the SI joint are very common in breaststrokers. And then degenerative spinal issues. And Amanda did a great job covering them. In youth swimmers, what we see periodically is spondies, and you see them in your breaststrokers and your butterflyers that do a lot of repetitive extension in the spine. But as athletes age, you start to see disc issues, degenerative issues that come along with that. So swimmers ripe for issues. Those that have body composition and physique changes, we start to see issues when kids hit puberty and start to get hips and breasts, and that changes their center of gravity, how their body moves through the water can be a lot of issues. Women through pregnancy, as their body starts to change, is going to have a lot of alterations. And then the more mature athletes that start to get some postural issues as we go through can be an issue. With training history, how many times a week the athlete's working, what their yardage is. A lot of people talk about overtraining, but the problem with undertraining has just come to light in youth athletes. And if they're not doing what they need to do in the pool enough, they're just as much susceptible for training problems and injuries as those that are overtraining. Novice swimmers versus elite swimmers, you'll get kids that start, or even more mature athletes that have never swum growing up, and they may have the speed or ability to be in a certain group, but not have the training background that other athletes do. So when they come in, the coaches need to be very careful with them so they don't inadvertently get overtrained. Your elite athletes sometimes are just doing too much. See a lot of multi-sport athletes in the pool, and they're a challenge because they're not only training one sport, they're training 2 additional sports. So it's imperative that they get in the water about at least 2 days a week. And you've just got to balance how much they're putting in to their training so that they don't get injuries. Work-life balance with your adult swimmers. They've got work to contend with. They've got families to contend with. They also want to do things in the pool. So it can make it very challenging for them. With your youth athletes, they've got practice at 5 in the morning, then back again at 3, and they've got to do homework and different things like that. So that can be very challenging for those athletes. Family issues, if there's a lot of stress at home, that can reflect itself in training in the pool. Distorted sleep patterns during the school year, if the athletes aren't getting enough sleep, that can be a challenge, or if they have sleep disorders and they need to be referred to a sleep medicine specialist. And previous injuries, surgeries, and medical issues, which you run into as you get to be a little bit older. So if you have a problem, where do you start?
Hey, Skippy,
First,
I'm going to interrupt again. We cannot see your slides. They're kind of blurry. I have your PowerPoint. Do you want me to share my screen so we can get these out?
Sure.
Okay. Sorry to interrupt.
No worries. Sorry, it's not coming through.
No.
Do I need to share?
Yeah, go ahead and stop sharing your screen and I'll pull your PowerPoint up on my side and then we'll go from there.
Okay.
All right. There you go. Take it away.
Okay. Whoops. Okay, so where do you start? Good pain versus bad pain. Next slide. Good pain, you're going to have pain in swimming. If you don't, you're not doing what you need to do in the pool. So good pain is the burn, short duration, doesn't interfere with workouts, may occur during or slightly after practice, and doesn't wake the athlete up from sleep. Next slide. Bad pain, on the other hand, is pain that increases with intensity as practice continues, pain that doesn't subside with rest, pain that impacts on the swimmer's performance, constant pain, pain that doesn't improve with ice, non-steroidal anti-inflammatories like Advil, Aleve, ibuprofen, pain that wakes the swimmer up at night, pain with swelling, and pain that impacts the swimmer outside of practice. And these things need to be addressed. Next slide. So what do? If you're an athlete in the pool, first thing, we very rarely kick swimmers out of the water. They've done a lot of studies, and even a week out of the water, a swimmer can lose his feel for the water, and it can take weeks to get that back. So we train the strokes that don't hurt and stay away from the strokes that do. We modify intensity, so changing effort. So if a coach wants somebody to be at 90% in a particular set, we start them at 70, and each repeat, they increase the intensity till they get to the point where, let's say at 85%, they're okay. They try to hit that 90%, they have pain. So they finish the set at 80 or 85% until they're doing better. We modify equipment. So kickboards, paddles, pull buoys. Kickboards I get rid of for shoulder athletes right off the bat because it puts their shoulder in an impingement position. Paddles are things that kids wear and swimmers wear on their hands. There's all sorts of sizes, from little hand paddles to some that are the size of a sheet of paper. I used to tell the athletes to get rid of paddles, but for some athletes, hand paddles give them a little bit better feel for the water, and they actually have less pain. So if they have less pain with paddles, they can use them. If not, we get rid of them. And then pull buoys are a float that goes between their legs. If you have somebody with some back pain, a lot of times that puts their back in extension, and you may have to deal with decreasing that. Stroke correction is imperative. If you're doing something in the water, even if you do a lot of other things to help, if you don't correct what you're doing wrong and putting stress on the body, that problem's not going to go away. We modify yardage. Don't go quite as far in a practice, and work with a coach on gradually increasing that back to normal. Change lanes or position in the lanes. The leadoff swimmer in a lane exerts 30% more energy than people following them and drafting off. So switch them so that they're not going first, although that can be sort of a loaded cannon with age group swimmers because there's a lot of pride into where you go. So you've got to do a lot of education with the swimmers. And if they're doing dry land or strengthening exercise out of the pool, you need to assess that and modify that. Next slide. So what if that doesn't work? Next slide. When do you seek medical care? If you have persistent pain, persistent swelling, deformity, loss of motion, loss of strength, or loss of function. Next slide. So who to seek medical care from? Preferably a physician that's used to seeing swimmers. And fortunately in the Metro Atlanta area, we've got a lot of those. As I mentioned earlier, some physicians misdiagnose somebody with instability and they're just lax. Also, they understand that you don't want to right off the bat totally kick a kid out of the water. Physicians that understand athletes and active individuals at all ages. One that understands that even in a mature athlete, that sport is as important to them as those that might be trying to make the Olympics or get a college scholarship. You want to get a physical therapist that understands swimmers and is used to seeing swimmers. It's not that somebody that can't get them better, but one that has a swimming background, understands the nuances of the sport. They know what questions to ask, what to target, and it's a little bit easier for them to progress that swimmer back into the sport. And complementary medical professionals. So your massage therapists, chiropractors, acupuncturists, et cetera, can be of benefit. Next slide. So treatment plan. Coaching is imperative. They need to have stroke correction and a good solid training plan. I have an extensive background in my previous life in swimming from age group all the way up through D1 collegiately. I don't correct my swimmers' strokes. I leave that to the coaches, but we work together as a team so I can emphasize the things that coaches are emphasizing in practice so the athletes understand that that's important. A good solid home exercise program consisting of strengthening, range of motion, stretching exercises, and core stabilization exercises. And you've got to stay on the athletes, or if you're the athlete, you got to do that program. Because if you're not going to get better. I started having my swimmers keep a log of their training, how many days a week they're in the pool, what they're doing, what they're needing to modify, as well as what they're doing outside of practice for me so that I can help hold them accountable so we can get them better. For those that have the resources and may need a little bit more guidance, a personal trainer that's versed in working with swimmers can be beneficial, but you need to coordinate your care with them, and they need to coordinate also with the coach, especially if they're in an age group program, so everybody's on the same page and they're not doing things excessively or repetitively. And rest is important. Active rest, cross-training, coordinated activity modifications, and look at outside activities. Next slide. So, everybody looks at triathletes or swimmers, they're phenomenal athletes, but they're not always the best athletes. They're always moving in the same direction, unlike your softball players, your soccer players that are doing pivoting, twisting exercises. And they're susceptible to muscle imbalances. They work the front and frequently neglect the back, and those things need to be addressed. Next slide. So we need to deal with posture. You want to start with a good foundation, stack the blocks. For those of you in the audience that have been sitting all day long, if you roll your shoulders back, drop your shoulder blades down, stack your shoulders over your hips, you're going to notice all of a sudden it's a little bit easier to breathe and it takes a little stress off your body. For the health professionals in there, change what you can, modify what you can't. You're dealt certain cards and you need to work around those things. I emphasize with the athletes, if you're like the person on the slide on the left or picture on the left, you're going to not be as strong. The muscles don't work as well. You can't breathe as effectively. versus the picture on the right, you're going to be a lot stronger. So I emphasize performance in the pool as opposed to getting yourself better. And I just tell them, think about being a speedboat, not a tugboat. Next slide. So you develop a treatment plan, and the components of that are, first of all, mobility. Do you have enough range of motion to swim? Stability. Do you have the muscle control to use that range of motion? Next slide. Some of the components of those programs are stretching exercises we frequently use in summers is hamstring stretches, working on their glutes, their thoracic spine, their pec muscles, the sleeper stretch, which works on the muscles in the back. Swimmers tend to have a lot of motion where they reach their arm backwards, but if they bend their elbow at a 90-degree angle and come down, they lose that internal rotation, and that's important for the strokes. Strengthening exercises, some basics for good basic exercises for swimmers are your ITs and Ys and their shoulder blade exercises. Those shoulder blade muscles are also part of their core, which is crucial for swimming. They're external rotators, so the muscles in the back of their shoulder. Core exercises, we do a ton of core with swimmers. And we try to make them as dynamic as possible. A lot of swimmers think they should just do curl ups all day long, and that's not an effective core strengthening exercise. And it's important not to forget the glutes and the hips because they drive the motion. That's where a lot of your power comes from. Next slide. Stability is important. So stability is controlling dynamic alignment under load and fatigue. So you need to be able to do things when you first get in the water, but practices go, hour and a half to sometimes 3 hours. So you need to be able to last the whole practice. And strength without control doesn't work. It's not effective. So some balance exercises to help with stability are bossy ball, physio ball activities, single leg stance, and power. Power is how quickly you can generate force. But when you're doing power activities, form and control are imperative. And things along this line are jumping, plyometric activities, kettlebell, medicine ball activities. Next slide. So the goal is to make the swimmer a more rounded, better athlete so that they can be successful in the pool and perform it the way they want to. Next slide. I put down 2 references to get more information because we covered a lot in a short period of time. One is USA Swimming, and they have a host of information from not only injury prevention, they've got nutritional articles. They are a wealth of resources for those of you who are looking for swim teams in the Metro Atlanta area. And then USMS is United States Master Swimming for your adult athletes. Once again, they have a whole host of information. They also have some online workouts that you can do. They have resources to help find a master swimming coach. And for those of you that have to travel a lot, they have a site called Places to Swim where you can find master swimmers or pools that you can use when you're out of town. And I want to thank you very much.
All right, thank you, Skippy.
You are welcome.
All right, so next up, again, if you guys have any questions, please write them down in the chat or the Q&A panel and we'll get to them at the end. Next up, we have Sarah Coronel. So Sarah, you can go ahead and start sharing your screen and take it away.
It looks like, I think, can you help me access my video, I think?
Yeah, so if there's a place in the bottom left-hand corner, it should say video or mute.
Yes,
you can
yes.
click on it, it'll take away the red line.
Yes, I think it says you stopped my video though.
There we go, let's see.
Perfect. Thank you, hello.
Oh.
All right, let me share my PowerPoint here. All right, hi there. My name is Sarah Coronel, and I am the athletic trainer at Emory University that works with the volleyball and softball teams. I was also previously the athletic trainer for the volleyball team at the University of Virginia. So I'm really excited to be here today, and we're going to be talking about shoulder pain in volleyball athletes. Volleyball has become increasingly popular in the past 10 to 15 years. If we look at high school volleyball specifically and compare the 2008-2009 school years with the 2018-2019 school years, you'll see that there was a 8.4% increase in participation. And then if we look at the college setting and compare the years 2005 and 2006 with 2015 and 2016, there was a 22.2% increase in female volleyball participation, which is awesome. So we see that the female volleyball athletes continuing to increase. So in volleyball, shoulder injuries can be quite prevalent, and they can account for up to 20% of all volleyball-related activities. Now, sometimes athletes in positions that require the most overhead activity and like hitting have a higher risk of sustaining shoulder injuries. So it's important to understand the positions and which athletes might be at higher risk to develop shoulder pain or shoulder injuries. So first we have the outside and opposite hitters, and these athletes are going to be hitting with a lot of power. They're going to be hitting the ball over the net with a lot of power and very often. The setter is responsible for passing to those hitters. They're kind of the all-time passer. And then you have your middle blockers or your middle hitters. These athletes, defensive stance, but they often hit over the net, just like the opposite and the outside hitters on offense. So really, these three athletes all will block, which is an overhead action, but it's different than the hitting motion when you're cocking your arm back to hit the ball across the net with power. And then last but not least, we have the defensive specialists and the libero. And these athletes are going to be doing everything they can to stop the ball from hitting the ground. But these athletes don't necessarily hit as often as the other positions. With that being said, all of the positions need to be able to serve. And as you see in the photo on the right, it requires you to bring your arm back in that motion and hit with a lot of force to get the ball over the entire court and across the net. So although those positions, like the hitters, have a higher risk because of their repetitive overhead motion, everybody on the court has a chance to, or is at risk to sustain a shoulder injury because of all of the serving that they do as well. So with that, they could develop shoulder pain, or they could develop something called GERD. So what is GERD? GERD is glenohumeral internal rotation deficit, which is essentially saying that you don't have a normal amount of internal rotation, range of motion of the shoulder, tip rotation, and 90 degrees of external rotation. But when athletes are repetitively doing overhead movements, what tends to happen is they lose some of that internal rotation and they end up gaining external rotation actually. So GERD is not associated with shoulder pain or shoulder injuries, but it can be a risk factor for these things. So with that being said, it's very important to make sure that you're strengthening, stretching, doing joint mobilizations, and making sure that you're optimizing hitting technique. Now, whether you're experiencing shoulder pain, GERD, or you're feeling 100% healthy, it's hugely important to spend extra time on shoulder injury prevention. As we discussed, some positions on the volleyball court may be at a higher risk and may need to be doing this program more than others, but all of the athletes will really benefit from one of these programs. So the keys to an injury prevention program include a proper warm-up prior to activity, improving your range of motion, increasing or maintaining strength, and then optimizing technique of hitting or serving. And I'm not going to go into as much detail on that last one because this is something that the coaches are going to be more, this is more their expertise, but it is so important to make sure that you are doing the right technique, because if you're not, you could put the structures of the muscle at risk for injury. So let's talk about a proper warm-up. Whether you are going to do exercises at the gym, at your house, or in the athletic training room versus just going to have a volleyball practice or an individual, it's really important to get a warm-up in. And that could include arm circles, jumping jacks, mountain climbers, anything to warm those muscles up. Now, if you're going to be lifting or doing a home exercise program, you could do just those things and then start doing your exercises. But if you have a volleyball practice, like what I have my teams do is kind of incorporate the injury prevention program in the warm-up itself. So we'll start off with doing a full body warm-up, and that might include arm circles, mountain climbers. But then I'll have the girls pair up with a partner and use an exercise band and do some strengthening exercises, which will warm their shoulder up, and it's really great strengthening just during the warm-up itself. And then finally, they'll do any stretching they need before we start going with volleyball drills. So it might take, for coaches, it might add a couple of minutes to the warm-up, but it really, really goes a long way. So the next thing we're going to talk about is increasing the range of motion, which essentially is stretching. These exercises that I added here are awesome because they really don't require a lot of equipment and are, will be beneficial in increasing the shoulder range of motion before you really get going with activity. So on the left, you'll see, she's got her arm outstretched, she's getting a good pec stretch. You can do it with your arms up overhead or in the 90-degree position as well. And then these two photos on the right are the guy in the picture is stretching and he's increasing his internal rotation range of motion, which is really important. Like when we talked about GERD before, with that lack of, or that internal rotation deficit, this stretch is going to be awesome because it'll help offset that imbalance. Oops. Okay, so let's get into strengthening. So if you have an exercise band, there are a ton of different strengthening exercises that you can do that will be beneficial. And you can set these up with, you can use a partner with these, you can attach them to the wall, a lot of different options. But the photos here on the left, and this one right here, he's doing internal and external rotation at the side. And you'll see he has a towel there in between his arm and his torso. And this is to make sure that the right muscles are being activated when he's doing that exercise. And another thing important to note is when you're doing these exercises, to pull your scapulas back or to pull your shoulders back in order to activate and engage the right muscles as well. In this photo, he's doing band pull aparts, and you can do these with your knuckles facing out, like in the photo, or you can do them upside down. So I guess either way is really beneficial as well. And then the photo on the right, you'll see he's starting, the band is kind of down and he's pulling it up. Another modification that I have my athletes do is if you start with the band up high and then you pull it down across your body. It's almost mimicking a volleyball hit. So that's just another great exercise to use as well. So in addition to the band exercises, or instead of, if you don't have access to an exercise band, are the I's, T's, and Y's and W's that was mentioned previously, I believe. So these are great. You can do them. You're just going to be laying on your stomach with your thumbs up and out in a T position here. And you just lift them for 3 seconds, hold, and then bring them back down. Again, with this, make sure that you're pulling your scapulas back so that you're activating the correct muscles for this. And the same idea for, the I's, T's, and Y's. You're essentially making that letter with your arms. So on the left, he's doing a T, and then you move your arms a little bit into a Y shape, and you do it that way. And then I don't have a photo, but you can, for the I, you just put your arms out in front of you. And then finally, you can do the W, or you kind of make a field goal with your arms, and you have your palms facing downward and lift. So these are really great exercises for the shoulder strengthening as well. And I would say when we're talking about rehab exercises, it's really beneficial to do them 3 to 5 days a week. If you can do them, if you can integrate them into your warm-up and you're doing them every day before practice, that's ideal and probably the most time efficient. But otherwise, if you can do it 3 to 5 times a week on your own, that will also be beneficial. So we do the shoulder injury prevention rehab to avoid getting injured, but as we know, injuries tend to happen. And before we talk about the rotator cuff injuries, I just want to talk about that as a structure. So the rotator cuff is composed of 4 muscles: the teres minor, the supraspinatus, the infraspinatus, and the subscapularis. And you can kind of see there's a diagram over here to kind of show you where they are on the scapulas. The rotator cuff is mostly responsible for shoulder stability, but more specifically, it's the main driver of external and internal rotation, and then shoulder abduction, which is essentially if you move your arm away from your shoulder or body. So common rotator cuff injuries include a strain, tendonitis, or shoulder impingement. And a strain can occur to any of these 4 muscles or multiple. And typically when you're talking about a strain, this injury, it's an acute injury. So it happens by a single traumatic event, whereas tendonitis occurs, it's an overuse injury, and it occurs after repetitive movements without enough rest. And a muscle strain is affecting usually the muscle belly, where tendonitis is inflammation of the muscle tendon. So a little bit different. And then you've got shoulder impingement, which is when the soft tissues become entrapped in the area of the shoulder joint. And this is often because of a shoulder or a rotator cuff defect. So if you have pain on the side or the back of your shoulder, I'd say, typically you might be feeling a rotator cuff strain or tendonitis. But if you feel it in the front, in addition to those things, then you might be feeling some shoulder impingement. So another structure of the shoulder that tends to get injured is the bicep. The biceps brachii is composed of a long head and a short head, mainly responsible for elbow flexion and forearm supination, and a little responsible for shoulder flexion. So like the rotator cuff, you can have a bicep strain or a bicep tendonitis. And it's the same concept, just with the bicep muscle. So the strain is going to tend to happen from an acute injury, and tendonitis tends to happen over time because of an overuse. Oftentimes, if an athlete is experiencing pain on the front of their arm, then it could be a bicep injury. Finally, we have the glenoid labrum. So the shoulder labrum is cartilage that lines the rim of the shoulder socket, and it is responsible for reinforcing the ball and socket joints and making sure that there's smooth movement in the shoulder. Now, the labral tears, I think, are interesting because it really depends on the extent of the tear. And if you're looking at volleyball athletes, collegiate volleyball athletes, and you were to get imaging on 5 healthy athletes, hitters, it's very likely, or it would be common or likely that the majority of those athletes would show some sort of a fraying in the MRI of the labral tear. So just because of all the repetitive overhead hitting, even though those athletes have no pain and they have full function, just because of the overhead constant repetitive hitting, they develop some fraying. But, you know, just you're not going to go and MRI healthy athletes. So, you know, if an athlete does have some pain or loss of function, then it's important to try to decrease that or maintain it and continue to increase function so that the athlete continue playing. But sometimes, obviously, that doesn't work out, and you know, it comes to a point where you need to meet with the physician and decide on whether to get surgery or not. But the labrum it's a cartilage, so once you injure it, you can't necessarily, you know, once it starts fraying, it's going to stay that way unless you get a repair. And so, like I said before, it's important to kind of assess the pain and function of the athlete and see if you can maintain that before going to get surgery. So in summary, volleyball players often experience shoulder pain and GERD, and it's really important to focus on shoulder injury prevention exercises such as the stretching, the proper warm-up before activity, and the strengthening, and definitely making sure that you're using the right technique in order to prevent injuries from happening. Thank you. I look forward to questions in the panel.
All right, thank you, Sarah. All right, so if anybody has any questions, go ahead and type them up. We do have one for Skippy. So our question for Skippy is, would you say that it takes swimmers a little longer to rehab a chronic injury since you aren't encouraging them to come out of the water and only modify training yardage? So for impingement, how long can it take to feel consistently better?
Swimmers are difficult, some of them to rehab because they are so lax and loose jointed. So some of them can almost be in therapy for, you know, 6 to 9 months, sometimes longer. So we start seeing them, getting them set up, you know, maybe twice a week to get them on a good solid strengthening program, stretching. I also do some soft tissue work with swimmers, which can be beneficial, and then gradually wean them off PT, but see them periodically. Because swimmers are so lax, they tend to, after a while, sort of disconnect where their body should be. And so sometimes they just need a reset to make sure that they're moving correctly and getting better. But it can take a long time for them to get better at, and it's something that they have to work diligently on. Most of the athletes, swimmers that have shoulder pain, I tell them it's something that they're just going to have to do on a regular basis. They're strengthening exercises 3 times a week, and they're stretching exercises every day to do what they need to do in the pool.
All right, thank you. So I don't see any other questions in the chat or in the Q&A, but I'm going to pull Dr. Jimenez back in here. So I have seen, as a physical therapist, I've seen a lot of neck strains with Brazilian Jiu-Jitsu, some of my patients who do Jiu-Jitsu. Any advice on preventing those, or when to get back, how much time to take off, when to, you know, treat?
So I think the big problem with fighters is they're not going to listen to you anyway. So especially and unfortunately it's the truth, you know, I've had several that I've had to treat either with injections or surgically. And like I had a meniscus injury from one of my coaches a couple weeks back, and I said, okay, I want to repair this, if I can repair it, will you take the time off? He goes, I'll be on the mats next week. So you just cut it out. Like, you're not even going to try. So it's a very different athlete where they're not going to take the time to recover because this fight is everything to them. Or even the ones that do it as a sport, as a hobby, they won't take time off. So I think the best is teaching them prevention, stretches, and honestly teaching them that it's okay to tap, because people won't tap with chokes, and there's something called inversion, which is kind of where your legs are stacked on top of you and your neck is twisted and bent, and then the whole body weight comes down. That's probably what it's from. People going upside down a lot.
Yeah.
And positions you're not usually in. So counseling people to avoid those things. And then even in the recovery phase, I'll tell people when they have neck injuries to play more of a top game than being on on their back.
Mhm.
Like versus wrestlers who like to be on the top, jiu-jitsu practitioners sometimes are better on their back. It's something called a guard where you are on your back and you're throwing up submissions from there, but there's a lot more stress on the neck.
Mhm.
So if you just counsel them and say, you know, during these next couple weeks, work on your top game. That's what I usually do because they're not going to stop.
I mean, I think that's a general with any athlete. They're not going to want to get out of the game. I mean, I'm sure any of you panelists can speak to this. But a lot of my patients will come in and, you know, even working as an athletic trainer like I did, you'd have them run off the field. You know, I had one patient come off with his eyebrow ripped in half and he's like, I'm going back out there. And I was like, you need stitches. So it's tough to kind of find the balance between what injuries can you work with and what do you need to say, hey, take a break and calm down. So I don't know if Skippy, Amanda, or Sarah want to chime in there with your specific sports, any of your experiences with that.
Sure. You know, swimmers, you know, they're going to do what they want to do. The thing that people need to realize too with swimmers is once they are out of the pool, they are the most uncoordinated people that you'll ever meet or see in your entire life. I mean, most of injuries other than repetitive overuse injuries that we see from swimmers are them breaking ankles, you know, tripping over their swim bag, breaking wrists, falling off starting blocks. You have to also be careful to pick and choose the exercises that you decide to do. I've had 5 swimmers tear their labrums on ab rollers. And I agree that ab rollers are a great exercise, but swimmers tend to have a lot of difficulty with them. See a lot of low back pain. They fall off on them and different things like that. So with swimmers, when you're picking your exercises, you need to take that into consideration. But I mean, swimmers have, if they're lucky, a month off during the year.
Hi, I'll just chime in too with volleyball athletes. I think the athletes that I work with are pretty compliant with doing the rehab and exercises, but you know, these kids at Emory have so much, I mean, all college athletes have a ton going on and they're involved in all these different activities and they have to lift and they have to do all these things. So when they're in the athletic training room, like I really try to make sure that we're using the most, like doing the exercise where we can get the most from them, because they really do have a lot going on. So just making the best use of their time that they are committing to doing what they need to do.
Great, thank you.
I was just going to add with softball players, most of the time I'm pretty realistic with them and I'm pretty straightforward with them, and I let them know what they're running the risk of injuring and what their downtime can be. And it's very easy to convince them, hey, let's do some preventative work so we don't risk not being able to play, not being able to pitch, not being able to throw, going down the line. Education goes a long way. As far as that goes, and doing things very similar to what Sarah was talking about with the preventative exercises during warm up. I think that they find 5 minutes doing some bands goes a long way with preventative.
All right, well, thank you, everybody. I don't see any more questions, so last chance if anybody has a question. Otherwise, our next speaker will be in room 1, and that's going to be Dr. Courtney Gleason talking about keeping women in the game, the benefits of female athlete attrition and exercise and sport. So thank you all so much for attending today, and thank you panelists for some great presentations. And I will see you guys in room 1.